Today I'm going to talk about end-of-life care. For family members, preparing for end-of-life can be kind of hard. So you always want to make sure that there's a living will or advance directive if you get the option to be able to do that. Um, and then where the patients are going to have their end-of-life care, whether it's in a hospital, a home, or inpatient hospice maybe. And then there's many physical, emotional, spiritual, and mental signs of an impending death for family members to kind of watch with their loved ones. So when you kind of notice that things are changing, such as restlessness, their sleeping, their intake for food and liquids, if they're just kind of more isolated, you can notice when it gets later stages, there's more color change, congestion, and even a change in breathing. So also a lot of family members find it hard to let go of their loved ones, but one thing that a lot of patients will wait on is for that permission from their loved ones for them to pass. They just want to hear it's okay and that they're going to be all right without them. So that is something that a lot of those on their deathbed do like to hear from loved ones. Hospital care is the most common place for deaths to occur in the United States. I think they say almost 50% of deaths in the United States do occur in the hospital. This can be more of a sudden, unexpected death, though, so in this situation, a lot of the times there may be no time for planning things out on where the patient would like to have their end-of-life care at. There's a lot of emotions involved when you're in the hospital, but the good thing about it is there's staff to help guide you with the appropriate care options, give you those options, and then get those right people in to help you with that. One that is provided in hospital care is called palliative care, and this is where they just kind of focus on managing your pain and your symptoms. It isn't to promote or elongate your life. It's more just for the comfort part of it. Inpatient care is another one that is an option for end of life. Nursing home is probably more common one. In the nursing home, you can get either the palliative care or otherwise hospice care can be provided in this place. So hospice is more devoted towards the terminally ill. They have the same type of goal for pain relief and just comfort as palliative, but when you're in hospice, it's for those who have no more than 6 months to live. Is kind of where they're thinking the doctor would diagnose them to be terminally ill in that situation. But in hospice, they do address more spirituality. They'll come play music for you, they visit with you, they have pastors that come and talk to you. There's nurses, and then there's aides that come and bathe. So they have more of a wide variety in that situation, and then they also do provide care for the family members. Home care is probably one that most people would prefer, but is not always an option. This is where care is given either by the family, and then sometimes they can have medical professionals come in and visit them, maybe a few times a week. In this case, you can have hospice care or palliative care in your own home. And this type can be more of a burden on family members, especially when it gets down to needing 24-hour care, but they are in the comfort of their own home in that situation. After a loved one's death, there's a lot of emotions involved. So bereavement and grief are the two that are very common. Bereavement is when you actually acknowledge that one's death has occurred. Grief is how we kind of deal with the loss. So there's stages within it. Denial is always the first stage, where we kind of withdraw and isolate ourselves. We can be kind of mad that they left us, and that's the anger part of it. You can be mad thinking that you could have done something to change the outcome. Another is bargaining, where you make promises and then deals just to make the pain go away. And then depression is another, and this is usually something that sets in later. So it's not something that happens right away, and then it is only for that episode too. So this doesn't go along with like chronic depression. This is more of an episodic depression. And then acceptance is the final stage, where we do look ahead, we don't look back, and then we just kind of plan for the future and our outcome from here on out.